So let us introduce to you PreLeaf, formerly known as Kitchen Confidence. My name is Nora White. I'm a grad student here in the School of Public Health and Nutrition and Dietetics.
My name is Nehal Molasurya. I'm a second-year student at the School of Information, and I specialize in human-computer interaction.
My name is Gabriel Martinez Santibáñez, and I'm a PhD student in biomedical sciences studying obesity and diabetes.
So you've just gone to your doctor who's diagnosed you with prediabetes. This means you're at high risk of developing diabetes, and you're one of 90 million people in the country like this. Your doctor refers you to a dietitian who gives you a big old pamphlet here and a meal plan. You have 6 months to make something happen, some changes, some progress, but you really have no idea how to do this, and you're left confused and alone and lacking confidence. There's the 6 months. So what happens during this gap? We went into the field and interviewed 60 plus pre-diabetics and diabetics to see where they had problems. We asked them, do you have information on your condition? How did you use it? Was it helpful? Did it help you? And what do you still need help with? We distilled their responses, We distilled their responses and concerns into 4 themes: what to shop for, how to cook, how to make a plan, and where to get help. From this, we realized that pamphlets alone make a grave mistake. They assume that patients have basic nutrition education, shopping know-how, cooking skills, portion control strategies, and the ability to plan and set goals. So from that, we ask, are pamphlets enough to help solve prediabetes? And we would say no. So with that, to solve this problem, we've created PreLeaf, formerly known as Kitchen Confidence again, a smartphone and tablet app that helps pre-diabetics create healthier eating habits every step of the way. This does this with a 4-component approach: goal setting, nutrition education, cooking school, and a health coach. So you download the PreLeaf app, get started with some preliminary questions about yourself, about your cooking skills, and about your eating preferences. So next, you select your health coach, and essentially, you pick also some goals. These you can figure out with the help of your doctor, and these can be some goals like you'll see up here that are more health outcomes based, like I want to lose weight, or they could be more values based, like I want to be a little spicier in the bedroom and have more, like some more stamina. So next, once you start to use the app will help track your progress of eating habits throughout the day so that you and your health coach can review later on. So the nutrition education component's in-pocket grocery store guide helps you learn how to shop so that you break the grocery store up into sections so that you know the kinds of foods you should be buying. You'll also learn how to control portion sizes and balance macronutrients, which will help you feel fuller longer, and most importantly, help you keep your blood sugar in balance. Now this is the part of the app that gets innovative, or so we like to think. Users get to choose from a library of diabetes-friendly recipes that, most importantly, help you learn nutrition in context and help you cook the foods step by step. Many similar apps and diabetes management tools fail to address cooking, which is an essential component of healthy eating. But PreLeaf does this from the earliest stages, going from which pan do I use to then really important cooking technique questions like, how do I sear something? So how do you sear something? Let's watch. So to tie it all together, your health coach, who happens to be a registered dietitian, will be your touch point throughout this process. PreLeaf allows you to track your food intake, as you see here on the left, via macronutrients, as well as taking pictures of your meals so that you and your health coach can review this later. This will be shared with your health coach and potentially later on your actual primary care physician, and then that health coach will provide valuable feedback and the necessary motivation to keep going.
Say you strayed away from your plan and eaten a Dunkin' Donut cookie. Now what happens? You feel ashamed, you feel guilty, and that's what people quit their plan. So with PreLeaf, the coach will provide you accountability to get you back on track. Now, keeping users engaged in this process is another way of ensuring that they don't quit. So PreLeaf offers a toolbox of opportunities for engagement so that they can actively work towards reversing prediabetes. And this provides incentives like kitchen tools mailed to their doorsteps as they progress through the cooking school, online community for peers to engage with other people that are pre-diabetic, and to an ability to submit recipes to get feedback from peers and health coaches.
Prediabetes is an epidemic. There's currently 90 million pre-diabetics in the US. We in public health and in research are very well aware of this, and this tells us how important this problem is, and this gives us a huge opportunity for us to make a difference, especially since the Center for Disease Control tells us that 15 to 30% of pre-diabetics will develop diabetes within 5 years of diagnosis. So we've been able to make some estimates as to how many people we can actually reach. So we've estimated that out of taking the number 320,000 clinically diagnosed patients that are actually using health apps on their iPhones that are aged 18 to 44, that we can actually reach this size of the market. So if we take only 1% slice of this 320,000 people, this brings us to 32,000 potential users. Now we have an estimated early revenue of $400,000 to $1.6 million in the first 2 to 3 years, and this is taking into account, into consideration, how much health insurance companies have been willing to reimburse for diabetes prevention programs. Ooh. So how do we make money? So instead of a fee-for-service type model, we want to adopt a performance-based pricing strategy, which Obama would approve of with the ACA. So for this pricing strategy, we actually, taking care of these, considering these sponsors of health insurance, medical centers, hospitals, and employers, these people would get billed only according to how much the patient is actually using the product and how well they're performing on it. So we're taking a very common approach to Omada Health, which is one of our major competitors. So we leave you with a PreLeaf success story. So you, the user, have been able to find one of the many diabetes-friendly recipes on the app, and you've also learned how to make it, and you've been able to keep on track with the help of your health coach. Not only that, but you've been able to lose 6 pounds. 6 pounds that you're very proud to report to your doctor after your 6-month checkup.
But you're not done yet. With PreLeaf, you have more cooking techniques to gain, more weight to lose, and frankly, more health habits to gain as well. PreLeaf will help you with this every step of the way. Thank you.
Can you talk to me a little bit about how you'll get the word out about your app? How are you going to publicize this? There's a lot of apps out there that you might or might not compete with. How are you going to reach your audience?
So we've thought about that a bit. So we're considering a business-to-business model, so we would probably try to reach out through those medical centers or hospitals or through the health insurance companies or through the actual wellness through employers, something through that kind of strategy.
Quick follow-up. How will you differentiate yourself against the competitors that are out there? How's your story different?
Well, I guess, yeah.
So that's where our cooking school shines, because currently we do have models out there like Omada, which we mentioned, also Rise. But frankly, neither of them has a cooking school component, which is something that, as we mentioned earlier on in the presentation, that's where the people with prediabetes and people with diabetes that we interviewed really mentioned that was a lacking skill, especially in context. So that's something that, to us at least, would just completely outshine the competitors of having all of this encapsulated in one usable app.
Thank you. Good answer.
Yeah, initial enthusiasm often gives way. As Alexandra said, you're feeling down and you don't have the energy and you stop using all these tools that you provided. So talk to us a little bit about your strategy for keeping people engaged in a sustainable way.
Okay. All right. We're quite the teamwork here. So in terms of patient engagement, of course, we mentioned the health coach, who would really be the pinnacle of our program, because the studies have shown that then when you have someone who's an actual person, and especially too, we've chosen the text version of staying in touch. Oops, I'm sorry. then you demonstrate that there's actual engagement and motivation, and you build a lot of those values, especially through the goal setting, whether it's, as I mentioned earlier, it's values-based, or if you're really into losing weight, et cetera, you could have those goals as well. But we tried, because it's a comprehensive program, we tried to make it so that there would be incentives across the board of those 4 components that we offer. So like Nihal mentioned, there would be, for instance, as you progress through the cooking school, maybe you have a whisk at home, but maybe you want our whisk. And studies have also shown, as Gabriel could even mention if you wanted to hear more, that people just getting physical crap excites them. And so I saw that at the VA hospital when I volunteered, and even people getting teaspoons and things like that, or a packet of quinoa that they could then use at home. Man, these old guys were jazzed, So we anticipate that people would be excited about that, in addition to then other pre-diabetics or people with pre-diabetes then who could then engage with each other. And potentially this could even grow on a regional level. If it's a large thing, then you could meet in person and carry that through outside of just this online digital community.
I think we have time for one more question. So just great presentation. Where does the product fit into the primary care providers? What's the feedback in the bilateral community?
So directly with a primary health provider, not too much. I don't think we see it as a place where you tell your doctor, look, I ate all these vegetables. I think it's more of a in between the time where you talk to your dietitian and your doctor after the 6 months. That's when you can use our app, a way to replace that app, the pamphlet, I mean, so that you have, thank you. You have a guide to losing weight. It's the in between what we want to cover. That's the space that we see the most need for.
And we're not trying to replace primary care physicians or dietitians, for instance, especially since I'm going to be one. But it's more, again, that intermediate space and something that could work with them rather than as a replacement, especially since it is an online forum. And as Alexandra mentioned, and as Vic has mentioned, that in-person, values-based, you really have much more of a kind of interaction that way. So, thank you guys so much. Thank you.